In today's episode, we hear about the important work that Mount Carmel Health System in Columbus, Ohio, is doing to serve their community and vulnerable patients. This includes their street medicine program, which provides free urgent medical care to community members who are uninsured or underinsured, including individuals experiencing homelessness. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. In this podcast, Amy Coleman, Senior Associate Director of Federal Relations for the AHA, is speaking with Brian Pierson, the Vice President of Community Health and Well-Being at Mount Carmel Health System in Columbus, Ohio, and Lisa Wahoff, an advanced practice registered nurse at the Mount Carmel System. We talk about the importance of the 340B drug pricing program, which helps Mount Carmel provide a range of important services and programs to their community.
Hello, and thank you for joining us. My name's Amy Coleman. Let's go ahead and jump into our questions today. Why don't we start with you sharing a little bit about Mount Carmel Health System and the communities and patients you serve?
Sure. Thank you, Amy. My name is Brian Pierson. I'm the Vice President of Community Health and Wellbeing for Mount Carmel. So we are a Catholic health system located in Columbus, Ohio, in Franklin County. So it is the most populous county in Ohio, and it's a very population-dense county. We are a not-for-profit. We have 4 hospitals, inpatient rehab hospital, a number of freestanding centers, and outpatient facilities, surgery centers, urgent care centers. We do primary care and specialty care. We also have a hospice and a community health and well-being program, and I'll come back to community health and well-being here in just a moment. But I also want to mention that we are part of Trinity Health. We're very fortunate to be part of one of the largest Catholic health systems in the country. Trinity Health spans over 22 states, have 92 hospitals, and serve a cumulative of about 30 million people a year. So we're very blessed to be part of a large system. And one of the things that I think sets us apart is our ministry, that mission, and community health and well-being is one of those areas that sets us apart, and we provide services through that space that you don't typically see in health systems, or maybe I think people don't fully appreciate that health systems sometimes provide.
That was a great overview. Could you talk a little bit more about your community health and well-being services?
Absolutely, and thank you. So what I'm going to talk about are a series of services that are specifically designed to serve our community's most vulnerable. And what that means is people who are living in homelessness, people who are marginally housed, suffering from severe and persistent mental health issues, issues of addiction, oftentimes developmental disabilities, and for some, it's all of those things simultaneously. So all of these programs are geared towards serving people and removing the barriers that stand in their way, and clearly socioeconomics is a predominant barrier for this group. So real quickly, I'll just walk you through the programs because they're designed to work together and to meet people where they are. And I'll start with street medicine because it really is at the very basis of what we do. Our street medicine program really is going out on the land, finding the homeless camps. We have a myriad of different professionals that work there, a physician, 2 nurse practitioners, 1 psychiatric nurse practitioner who's on this interview today with us, Lisa Wahoff, and another family nurse practitioner, registered nurses, community paramedics, bilingual Spanish-speaking caseworkers, with the intent of meeting the biological, psychological, social, and spiritual needs of our really vulnerable folks. So we aren't just talking about taking care of whatever ails them at that moment. That's part of it. It's also about building ongoing relationships. So if we find out that, for instance, somebody needs housed, we're going to work with them as long as it takes to get them housed. We also have a program that works very closely with street medicine called Urban Health. Urban Health employs community health workers and peer supporters, again, with the intent on developing relationships with people who are struggling. Peer supporters are working with people who are dealing with the disease of addiction. They develop long-standing relationships, work with them to get them into treatment, supportive housing. When people who are dealing with addiction relapse, they'll work with them to get them through that relapse and back on track for whatever reasons that might have triggered that. And then our community health workers make sure that those social barriers that stand in the way, food barriers, transportation barriers, housing barriers, they'll work with people long term to ensure that they get them into stable housing, into primary care, into behavioral health care. They're working with these folks to make sure that all their needs are being met. So as we move through that continuum, and again, meeting people where they are, meeting them in their homes, in homeless camps, we have people that go out on bicycles. We have a Jeep that goes out on the land for street medicine. So it really is about going wherever people are. We also frequently come across women who are pregnant, who would be high risk for any of a number of reasons. It doesn't necessarily mean it's just physical high risk, but also socioeconomic high risk. So we have 3 programs that are intent on improving the health of moms and babies. Starting with our Welcome Home programs. We have a program that is employ registered nurses that will go into the home after a mom delivers, and they'll go into the home and they'll do a physical assessment of mom, psychological assessment of mom, physical assessment of baby, and a physical assessment of the home to make sure that all safety issues are managed. When we come across things like issues of sleep, where we think that the baby might be at risk for side effects of unsafe sleep, we can provide intervention there. And all of these programs that I've mentioned are programs that we provide at no cost. We don't bill for these programs because we know that for many, they're not insured, they're not insurable, and just the fear of receiving a bill for some of these services when they don't have all of the support systems in place that they need will keep them from coming to us. So these programs are provided at no cost within the community. Another program we have is called My Baby and Me. And that program is intent upon recognizing babies who might be born with developmental disabilities and ensuring that we get them linked into all of the services that they're entitled to. And then lastly, as it relates to mom and baby programs, we have a Moms to Be program. Now, that is not our program. That's actually a collaborative between Mount Carmel and The Ohio State University. We provide funding and we provide space for them to operate on our Franklinton campus. And that program is really about identifying women who are pregnant and who have high risks in their lives. And it gives them a place to come once a week where they receive a meal, education about how to stay healthy during their pregnancy, ensures that they are aligned with a physician and that they're seeing their physician when they should be seeing their physician, and takes them all the way up until delivery, when our Welcome Home team will then go in and make sure that they're safe and that they're seeing their provider. So then as we move down that continuum, as you'll note, people, as we follow them through that continuum of their best possible health, we're getting to a place where folks are a little bit more secure in their housing, and we can start talking to them about ways that they can change behavior to improve their overall health and well-being. So our Crime and Trauma Assistance Program is a program designed to meet the needs of individuals who have suffered from complex trauma, psychological trauma. And what that means is they may have been the victims of sexual assault or any kind of domestic violence, any of a number of things that might put people in front of us. Our licensed independent counselors that are all specially trained in trauma can work with them over time and their entire family. So we'll work with the entire family and or the individual, whatever the needs may be, along the entire continuum of age to work with folks and make sure that we get them psychologically healthy. And then last but not least, as we recognize that people, when their housing is a little more secure and they've got income and they don't have to worry about where their next meal is coming from, we recognize that that's not as good as it gets. So we have 2 programs, our Church Partners program and our Healthy Living program, that focus on that population. And so we offer a series of different things that are intended to keep people healthy: stress management classes, cooking classes, nutritional classes, classes around meditation and stress management. All of these, again, offered at no cost. And through our collaborative faith community partners, we can oftentimes offer these in the community, in churches, So we can expand our footprint without having to necessarily have the expense of bricks and mortar every time we want to reach out to another group of people. So all of these programs are designed to meet people where they are. And one thing that I do want to mention, there is one collaborative partnership that we have with our medical group. Lisa, who's on the line with us, our psychiatric nurse practitioner, helps anybody who's suffering from any kind of psychiatric disorder and splits her time between our crime and trauma assistance program and our street medicine program. We do bill for those services. However, we bill much like a federally qualified health center, which means that we will bill people based on where they fall within federal poverty guidelines. Anybody at or below 200% would not have any out-of-pocket expense, and we will never let money get in the way of our ability to serve them.
Thanks, Brian, for that wonderful overview. One of the programs that you spoke about and that we've certainly heard a lot of really good things about is your street medicine program. Lisa, I'm wondering if you can talk more about that program and how it helps vulnerable people in the Columbus area. And has COVID-19 made the program even more important?
Sure. My name is Lisa Wahoff, and I'm a psychiatric nurse practitioner. And so, because of COVID, we really had to switch the way we thought. We really needed to help the folks that we're working with and those who are experiencing homelessness in a more comprehensive manner. We shifted to, we usually provide clinics throughout the community, and we have partners that we work with. Because of the stay-at-home orders and the social distancing, we really needed to rethink the way we provided services. So we went out to the camps to really work with them. And this was super important because their whole lives really depend on oftentimes the community that they know, which is, going to churches and community centers for meals, showers, laundry, libraries to get out of the cold and the heat. And they didn't have those options anymore. And they really were not able to get information about COVID as well as all the services that they may need. So we're very lucky because we have a number of people, like Brian mentioned, paramedics, nurses, physicians, nurse practitioners, and we all split up. And, our first immediate need was really to take a look at the health and safety needs that individuals in a camp may have. And that really includes bringing lunches, food, water, and offering social support, because a lot of times, they really need to, just be able to talk. And in addition to that, meeting their basic needs. And sometimes, we also bring clothes, socks, blankets, and depending on what season it is, shoes. They have a lot of, varied needs. Every person is different. Every camp is different. We also, at that time, would talk to them about the pandemic, talk to them about what was going on and what was important for them to know, and their responsibilities in staying safe, as well as keeping other people safe. And, again, they were concerned about the pandemic, but they're also concerned about making it every day, the threats to living outside. A lot of them also, they make money in different manners, different ways. And with really everybody, they were all afraid about going out on the streets because our community really shut down in terms of people, stayed at home and were working. So they were a lot more visible to, the police and other folks that might be interested in what they were doing. So a lot of times they just, fly signs on a corner and are asking for money. And that is basically illegal. But I think that, that's an important way for them to survive too. So, again, I'm a psychiatric nurse practitioner, and there are so many barriers to meeting those psychiatric and mental health needs when almost 45% of the folks that are homeless or experiencing homelessness have some type of mental health or substance or both diagnoses. And, the barriers there are not just the fact that they're living on the land, but they're also the fact that they've got, physical needs, because those need to come first, the food, water, in addition to any health care, chronic respiratory, chronic heart disease, a lot of times diabetes. They have to deal with those health concerns first before their psychiatric and mental health needs can be met. So that's, we really kind of focused on the harm reduction piece at first, trying to make sure that they were able to talk with somebody if they needed, if they were taking medications, which is oftentimes difficult for folks. Then we would also provide those medications, and that's what's so great. We can take medications out to the camps and provide antibiotics. We can provide say they have a diagnosis of anxiety, PTSD, or schizophrenia. We took medications out that they may have been taking before that we could help out for a time, or until we had a time to do a comprehensive assessment. So that's really a great opportunity for them and us to be able to talk and meet those mental health needs. In addition to that, we provide transportation in order for people to get to a medical appointment, get labs taken. We can also draw labs if we have to on site. Basic needs like telephones. Most of these folks have telephones that they're either changing out all the time or they're never charged. And so getting out to the camps and making sure they're safe, getting them into appointments was really important. The other thing is that I think in terms of mental health, grief was huge. I mean, people already, a lot of these folks are, they range in all ages, but many of them have really a lot of grief they've never dealt with. And then on top of that, they've had this whole social change with the pandemic where things have changed for them, and they're not able to communicate with others as much as they have in the past. And it seemed like we really were counseling and talking about working through grief. And that's where we can also help them get into counseling with the crime and trauma program. So that's kind of a nutshell of what the street medicine team does, which is a little bit of everything.
Amy, can I add one quick sentence here? Prior to COVID, we still have a 30-foot medical mobile coach.
Oh,
that
yes.
Mobile coach, it has the capacity to provide the same level of care that one might receive in an urgent care. And everything that we do on that is at no cost to those that we serve. We are getting back into that space right now. We're back into 2 clinics. Of course, we have to be very careful because of COVID. It's still there. We want to make sure we don't bring people into confined spaces. So we're being very careful there, working with our infection prevention team. So that's a really important part of that's a very important tool that we have at our disposal. I also want to add that, because this was mentioned by Lisa, prior to COVID-19, we weren't really in the business of providing people meals. We had partners who did that. Many of the soup kitchens closed as it relates to COVID. So
Right.
We have partnered with 4 additional agencies and community members. And since the beginning of COVID now, we've been able to distribute over 30,000 meals to our community. So we've been able to, through forced ingenuity, do things better than we've done them in the past. And we're going to continue those things that work for us. One additional part would actually be telehealth. So if our team is out on the land and there's no nurse practitioner or physician with them, and they come across somebody who has a need, they can call with their phone right then and there, connect to our doctor. Our doctor can do an evaluation over the phone, because we'll have the cameras and the ability to be able to see things, make a clinical diagnosis, and get people treated through telehealth. So these are all things that are going to carry forward even beyond the pandemic that is COVID-19.
Wonderful. Well, thank you both for that overview of all of the community health and well-being services that you're providing to the people of the Columbus area. Now, it's my understanding that the savings from the 340B drug pricing program help allow you to run many of the programs that you have just outlined. Can you talk about how 340B plays an important role in your ability to finance all of these wonderful services you're providing to the community?
Yeah, absolutely. That's a great question. So, as I mentioned earlier, all of these programs and many of the services contained within them, things like physical exams, making clinical diagnoses and treatments, health assessments and screenings, free nursing visits to moms and new babies, street medicine team going out on the land, all of these things we're providing at no cost. Even if we chose to begin billing for those services tomorrow, the revenues we would generate through billing third-party payers. Now, a lot of these folks don't have access to any kind of insurance plan, and we're dealing with people who are living in generational poverty oftentimes. We know that we would not be able to receive enough in revenues to cover the cost. So that's number one. Number two, we also know that just the possibility of receiving a bill for a lot of people who are living in vulnerability, who've already fallen through a lot of the safety net programs for a lot of different reasons, oftentimes behavioral health issues that have caused them to behave in ways that make people sometimes not feel safe. So they're not invited back to some locations. So we are sometimes the safety net under the safety net. So when we're working with this population of people, what we want to make sure is that economics are not a barrier. So with that in mind, even if we build for everything, we would not be able to cover the cost of these programs. So absolutely yes, the savings of a 340B plan help finance programs like this that may not be able to exist, or at least may not be able to exist in the capacity that they do now in the absence of 340B pricing.
Thank you for providing that overview of the importance of the savings associated with Mount Carmel's participation in the 340B program and what those savings are able to do in order for you to run these types of programs that have proven to be incredibly important during normal times, but especially so during the COVID-19 pandemic. Now, here in Washington, the 340B program gets a lot of attention from lawmakers over the past several years. Many have argued that the program needs to have some major changes, that there should be, for instance, a requirement that any savings associated with the program go solely towards providing free or discounted drugs to patients, which of course, some of the things that you've highlighted certainly would fall within that category. Of course, many of the things that you have talked about throughout this podcast go well above and beyond just simply providing prescription drugs and dealing with the well-being of the community in which you serve. I'm curious as we wrap up this conversation, what message you'd want to give to lawmakers here in Washington, D.C., having these discussions about the 340B program and what, if any, reforms might need to be made. What is the importance of 340B to the Mount Carmel hospital system?
There, oh, good. I thought I
You're
was on
good.
for a second.
You're
Okay.
good.
There are many. The first thing that comes to mind is while we do provide many different things, one of the things we provide through street medicine, we do have a pharmacy license, and we do provide pharmaceuticals, prescription medications, anything that is not controlled to our patient population, and we do that at no cost to them. So removing or altering 340B would be a threat to programs like that. I think it's also important to recognize that while we talk about COVID-19 and what will it look like on the other side, there's an emerging amount of scholarly literature on what is called the shadow pandemic. And there are 3 shadow pandemics that are coming out of COVID. One of them is the impact on behavioral health and addiction. We're seeing numbers go up already. The other one is around homelessness. And when people are living in homelessness, access to healthcare becomes more challenging. And the other one is around domestic abuse. So our ability to provide services to those who are most vulnerable in our population, most especially as we look to the other side of COVID, where a lot of the protections that are there to protect people from being evicted from their housing are about to be lifted. When those are lifted, we predict that many more people will find their way into homelessness. And the issues that we've already described, the ability for people to get into meaningful health care, the ability for people to get their prescriptions filled, not have to make decisions between where am I going to eat, where am I going to stay, and should I fill my prescriptions. All of those things would be risked during a time when we know, and the literature is telling us, that the number of people who are going to need these services is going to be on the rise. So certainly what I would want to encourage lawmakers to do is not to look at how do we reduce 340B, but how do we preserve it? How do we preserve a program that helps us serve those who are most in need in our society? And as it relates to COVID-19, those are the people who have been the most impacted, and that's usually the case. One of the gifts that a program like 340B Savings offers us is the ability to be proactive in our approach to serving the vulnerable. So as we look at overall healthcare costs, and we think about people who are vulnerable and do not have access to insurance, it is in everyone's benefit to keep them healthy.
Yes.
In the event that we don't see them early and they end up in our emergency department, and then they end up in a unit or maybe in an ICU, the cost to the health system is enormous, and the cost to the individual is enormous, because then once that person is weaned off of a ventilator and discharged from the hospital, the only place we have for them to go oftentimes is back into homelessness, and then they oftentimes end up right back in the hospital. So it is imperative that we have programs that are more proactive as it relates to serving the vulnerable, finding ways to keep them healthy, finding ways to keep them out of the hospital. That's in everyone's best interest. It's certainly in society's best interest.
Well, thank you, Brian and Lisa, for joining us today and talking about the amazing work that you're doing for the Columbus community and how 340B savings enable you to do some of that work. It really has been a pleasure talking to you, and we look forward to hearing more about your successes in the future. Thank you.
Thank you. It's our pleasure.
Thank you.